You know, he's been at the center of this hurricane. He's been in the eye of the hurricane trying to deal with everything that comes with it, and yet be able to look at people that don't want to hear the message that he's giving of truth and honesty, and yet still have to convey that message. I have so much respect for Dr. Avish Nagpal with Sanford Health. He is an infectious disease specialist. And during this whole process, we've used him here on Down the Road a number of times to talk to us about COVID, to talk to us about the variants, and to visit with where he sees us being in today's world. Not yesterday's, not a year ago, but today's, because this is something that has evolved. And so let's get a chance to visit with him again. Dr. Nagpal, good to have you coming down the road with us.
Thank you, Joel. Good to be back.
You know, I said earlier in the show before you joined us that, I don't get up in the morning anymore and think of COVID. I really don't. It isn't a big part of my life anymore, my thought process. My wife recently contracted COVID, and so I had to stay home for X number of days as per the CDC rules, and then I had to wear a mask when I did come out for, I think it was the extent of 10 days. So that's the only effect that it's had on me. Are you seeing more of that? Are we right to be more lax when it comes to COVID?
Yeah, I think that's what we are seeing, and I think that's okay for now. We have seen significant improvement as far as number of cases is concerned. I was just trying to go around the hospital this morning, see how things are, and all our patients are only on one floor. We have a total of 10 patients in the hospital with COVID. Only one of them is in the ICU. So this is a significant improvement from a greater than 60 or 70 patients that we had at one point in time, which was not too far long ago, which was about a month or so ago. So I think we are doing well from that standpoint. The other thing that has improved is the supplies of antiviral and monoclonal antibodies for treatment, and the demand has significantly decreased on the outpatient side. So that's also a positive. We are seeing a less number of cases and testing, and obviously we are able to catch people early in terms of testing, having a low turnaround time, and then reach out to them and offer them treatment if they are still within that 5-day window period from when their symptoms started.
So what would you recommend to people? I mean, if we're seeing this downturn and we're seeing this Omicron and this variant not be, and I'm not trying to put words in your mouth, you can speak to this yourself, but not be as lethal, for lack of a better way for me to put it, as what we have with the other variants. I mean, what would you recommend to people to do, Dr. Nagpal?
Enjoy your spring and summer while we are in this lull. So, that's correct. Now we can say confidently that the Omicron wave that just passed us was not as lethal, did not put as many people in the hospital. We were, expecting that based on data from other parts of the country and the world, and we were closely monitoring it on a day-by-day basis as how it pans out here. A lot of people got it. A lot of people have had a recent infection. We have a lot of people, majority of people who are immunized, vaccinated, I mean. And now, even for people, we were at one point of time really worried about people who are not vaccinated, and we wanted to make sure that we have enough drug for treatment for those people. And now we are in a place where, as I said, many people have had recent infection. They are vaccinated, and now we have enough supply of the medication that is supposed to keep patients out of the hospital. The only unknown right now is that what the next variant will bring, and there will be one. Whether how effective our vaccine will remain against that variant, and how effective our treatment options will remain against that variant. When that happens, I'm sure we'll talk again. But for now, I think looking at the trends, I'm kind of hoping that we'll have a normal spring and summer.
The shot that I got, okay, I've been vaccinated twice and I've been boosted. Is this now really similar to me getting my flu shot versus me getting a shot for polio. That one is going to helpfully keep me from getting very sick, which the other is going to make sure I never ever get polio. Are those things, is the shots that I've got in relation to COVID going to be something you see us continuously have to get?
Again, it really depends on the next variant, and I'm sure there will be one. So the chances are that it will be more like influenza shot, which keeps you out of trouble and out of the hospital, rather than trying to eliminate it completely. Because for polio, we only see 3 strains throughout the world, and we have had a lot of time to, mitigate that pandemic. And COVID-19 continues to evolve. We continue to learn more. Our vaccines are going to get better too as the virus evolves, as our knowledge evolves. But for now, the role of vaccines is as primary protection, and it is to keep people out of the hospital as much as possible, so we don't have to face this same scenario of shortage of staff, shortage of masks, shortage of treatment options all over again.
Okay. So, in terms of the practices that we're living our life by, you said have a good spring, have a good summer. I've never worn a mask in the summer before in my life. Outdoors, I never was big on that anyway during this whole crisis when I was outdoors, as per your advice before on some of this. Do you see the need for Americans to wear a mask anymore?
Yeah, so CDC recently came up with new guidelines based on the level of risk in your county. So you can go on the CDC website and see what the risk is. If the risk is high, then they do recommend wearing a mask indoors. But for now, about 70% of the counties throughout the country are at medium or low risk level. I think most of the counties in our state are in the low and medium risk level too. So for most people, I think it will be okay not to wear a mask during the next few weeks or months as we head into spring and summer.
What about being in crowds, Dr. Nagpal? Should one be afraid to be at a sports game, sitting with 50,000 people 80,000 people at a Vikings fan if all of them don't care if we win or not?
Yes, I think when we say indoors, we include the sports arenas too, including the Vikings US Bank Stadium in Minneapolis. Yes.
Okay, you talked about how there will be another variant, and you said that with such surety. Is that the norm here? Is that why do you feel that confident that there will be another variant?
Because over the last 2 years, we have moved our strategy from trying to eliminate the virus to mitigating its effect on the society. And we were at one point of time very hopeful that the vaccine will provide a path to eliminating the virus completely. But because of lack of uptake or not unavailability in many regions of the world, and the virus mutating over time, that didn't happen. So now we have enough people who have had the virus, and there are, masks and social distancing are not something that are sustainable over long run. So I think the practical strategy here is to mitigate it rather than trying to eliminate it.
I want to go back to those 10 patients you talked about that are in the hospital. How many of them have been vaccinated?
I don't have the latest data, I'm sorry, but it has not changed. Large majority of patients who end up in the hospital are unvaccinated, and almost everybody who's in the ICU is unvaccinated.
Okay. So that hasn't changed whatsoever. Even with Omicron, it's still, if you've been vaccinated, you're not going to end up in the ICU ward.
Correct.
Right. Okay. In terms of the response that government has had to this, it's taken a lot of criticism, but I want to just quickly let you speak to the fact that the rules have changed from the CDC because of the fact, I would guess, that Omicron has changed. Or I shouldn't say Omicron, but COVID itself has changed.
Yeah, so, as we have mentioned repeatedly during this conversation, that the virus is constantly changing, constantly evolving, and we have to constantly upgrade our strategies according to that. We are, as the virus continues to mutate, we have to keep working on adjusting our vaccination strategy, adjusting our masking strategy, adjusting our treatment strategy. if something that you're fighting is using a different strategy or evolving its strategy, and you don't evolve with it, that can only lead to a more disaster.
Okay. Dr. Nagpal, as always, thank you, sir. Thanks for making yourself available. Thanks for coming down the road with us.